Brikama, it will be the entire councils in the country. This problem is not only in Banjul, Serekunda, and Brikama. You find it almost in every part of the Gambia. So we want to deal with it across the board.
Member for Joswang, you have the floor.
Thank you very much, Honorable Speaker. Honorable Minister, knowing the responsibility of the municipal councils, it is responsibility of the government or the responsibility of the municipal council to provide markets and garages to their people than the government.
Honorable Minister, your mic is off.
The land belongs to the state, and the state allocates the land. But land that is allocated is based on guidelines. And the councils need to manage this land. These areas that are destined for markets and garage must be properly managed. And what we have realized that there are a lot of issues that need to be addressed together with the councils. Sometimes garages are changed into markets, and which is wrong, we believe, but we need to engage them so that we can discuss it and find a solution to resolve the matter.
The member for Woolly East, you can take the floor now.
Thank you. Yes, thank you very much, Honorable Speaker. Honorable Minister, this is not an easy thing, I know. How do you want to remove, for example, mechanical garages that are renting in compounds but operating on the roads and therefore congesting the roads as well? How do you want to deal with them?
Honorable Speaker, let me inform the member for Woolly East. What is illegal, and we reinforce the law. Full stop.
Question number 190 of 2025 by the Honorable Member for Serekunda.
Yes, thank you very much, Honorable Speaker. Honorable Speaker, could the Honorable Minister for Lands, Regional Government and Religious Affairs update this August Assembly on the Ministry's promise to provide affordable housing scheme?
Honorable Speaker, I'm happy to inform this August that the Gambia government is actively working on its affordable housing initiative. The Ministry for Lands, Regional Government and Religious Affairs has announced plans to lay the foundation stone to commence the construction of 10,000 houses, affordable houses for phase 1 by December 2025. This part of government's broader vision to construct 200,000 affordable houses over a period of 10 years. Thus, in our drive to support this effort, the government is trying to put up the necessary institutional framework, such as the establishment of a housing mortgage bank, in order to facilitate access to affordable homes, in order to help us realize this noble objective. Organizations such as UN Habitat, Shelter Africa, Social Security, and Housing Finance Corporation and Badia Bank are being engaged to secure the necessary funding. Additionally, the ministry is also working on identifying and banking lands for the purpose of the affordable housing project.
Thank you very much, Honorable Minister. Could you clarify whether your ministry has conducted any need assessment or demographic survey to ensure that the affordable housing scheme truly targets the most vulnerable and housing insecure population?
Mr. Speaker, through the Social Security, the Shelter Africa Group is working with the Social Security to have a proper diagnostic assessment of the housing situation in the Gambia. That process is ongoing as we speak. A delegation is to be dispatched here on Saturday to Algeria to go and attend their annual general meeting. And part of the topic to be discussed will be the process of getting Shelter Africa to do the assessment for this country.
Yes, thank you very much, Honorable Speaker. Honorable Minister, considering the urgent need of low-income families, can you inform this August Assembly whether your ministry has a defined implementation timeline for rollout of the affordable housing scheme, and if not, what are the challenges delaying its commencement?
Honorable Speaker, let me inform the member for Serekunda that we have not got that timeline in place as we speak now.
Member for Woolly East, you have the floor.
Yes, thank you very much, Honorable Speaker and Honorable Minister. As per my memory, this 2024 budget has something in store for the Ministry of Lands to engage in feasibility studies in relation to affordable housing scheme. How far has that disbursement and how far has that feasibility studies? Thank you.
As I said, the country lacks the necessary institutional framework, and that must be put in place, particularly the issue of mortgage bank. And there are a lot of things that culminate because private people must be involved. They bring in their money to invest in this sector. It is not going to be government money. What Social Security can do at most through the government can do through is to create the enabling infrastructure that would entice or that would allow private sector developers to get involved. Acquire the land, get this enabling infrastructure, and of course, then developers comes in to reduce the cost of the houses. This is all ongoing. These discussions are ongoing. And let me report that we had a very positive week this last week on this issue. So we are looking comfortable on this matter so far, and we'll keep this house involved of the new development as we move on.
Member for Banjul Central, you can take the floor.
Thank you very much. Honourable Minister, during your deliberation, you made mention of the phases, like you about to start the first phase. Which areas exactly are these? Are identified, rather?
I cannot give you those areas now because we have not concluded on it yet.
The member for Same, sit on.
Thank you very much, Honorable Speaker. Honorable Minister, in your response, you talk about affordable housing scheme. Is it going to be decentralized?
100% guaranteed it will be decentralized.
Question number 191 of 2025 by the Honorable Member for Banjul Central.
Honourable Speaker, could the Honourable Minister for Lands, Regional Government and Religious Affairs clarify to this August Assembly why subventions to the Gambia Supreme Islamic Council and Gambia Christian Council remain limited despite their requests for increased support to institutionalize staff salaries, and whether there are any legislative reforms underway within the ministry to grant these religious councils the legal authority to regulate organizations operating under their purview, particularly in relation to land ownership, allocation, or religious institutional oversight.
Honorable Speaker, I am pleased to inform this August Assembly that the current government subvention to both the Gambia Supreme Islamic Council as well as the Gambia Christian Council has remained constant, largely because it has not been factored in the 2025 approved budget of the ministry. However, since the request has been made by the concerned councils, efforts will be made by the ministry to factor an increment in our draft 2026 budget estimates submission. And once it is approved by this very legislative body, such increment will be implemented.
Thank you, Honourable Minister, for those assuring words. My follow-up would be, has the ministry done any needs assessment to justify whether the current subventions are adequate to support operational means or salary requirements?
We do not need to make assessment because we know it already. make assessment whether they need increment. We already know that they need increment.
No, Honorable Minister, I mean the adequacy.
The case of budget allocation is not within my purview. It's within this very august body that determines how government revenues are spent and utilized.
Honorable Minister for Land, Regional Government and Religious Affairs, I want to thank you sincerely for those answers provided. You may leave now. Honorable Minister for Lands, I've been reminded by my aides that you were not here during the last adjournment debate and also the, I think, debate on this. So they want you to be here on Friday.
Excuse me, Mr. Speaker, you repeat what you say?
Oh, she's, Honorable Minister, no, what she said when I was saying in the morning, you were not here, but you were present during the last adjournment. So she wants me to remind you to please avail yourself on Friday for the adjournment debate. Thank you.
At you, and I'll do my best.
Thank you, Honorable Minister. Thank you. Clerk, we may proceed.
Thank you. Questions for oral answers continues. Questions for oral answers, the Honorable Minister for Health.
Honorable Minister for Health, you may take the podium, please. Honorable members, questions for which due notices were given to the Honorable Minister for Health by honorable members for oral reply. Question number 137 of 2025 by the Honorable Member for Serekunda.
Yes, thank you very much, Honorable Speaker. Honorable Speaker, as promised, oh no, sorry, Health, where is it? Honorable Speaker, as promised, the Honorable Minister for Health intends to engage the relevant authorities to clear the road leading to the Serekunda Health Center, which is occupied by vendors to a degree that access to the health center is very difficult. Could the Honorable Minister for Health update this August Assembly on how soon this situation will be resolved?
Thank you very much. Distinguished Honorable Speaker and Honorable Members, I wish to inform the Honorable Member for Serekunda constituency that the Ministry of Health has engaged both the Kanifing Municipal Council and the Ministry of Interior to resolve this matter. But the vendors keep on coming back anytime they are cleared away. We have recently engaged the police and the council to find a permanent solution. Thank you.
Question number.
Thank you very much, Honorable Minister. Has the ministry assessed how block access is affecting emergency services such as ambulances or pregnant women trying to reach the health center on time?
Certainly, it is obstructing, especially at certain times of the day. Usually in the evenings, afternoons and evenings when they would have gone home, the place is clearer. But we've been getting recurrent complaints from the officer in charge of the facility. So really it is detrimental to the flow of traffic, and it could potentially, or it's even been causing delays in people getting in and out of the facility. So it is important that we deal with it. But typically it's difficult for the Ministry of Health to do it on our own. We need the partners. We need the council more so, because we've been informed that the council also goes to collect tax from them, even though they are there illegally. But when they sell, they also pay for the tickets that are issued to them. So it's like it's been condoned. So we believe we need to continue engaging the council, especially so that something is done about it. But they keep on coming back. That probably means that they also need somewhere to be. Thank you.
Question number 138 of 2025.
I still have a supplementary question, Honorable Speaker. So, Honorable Minister, what public sensitization efforts are being made to ensure community understanding and cooperation in clearing the access roads, especially among vendors involved?
Thank you. Our health promotion and education unit regularly engages the communities through the community radios, the other media outlets, to encourage people as to what they should do and what they shouldn't do with regards to health facilities and health services. Probably in this case, what we need to do is to encourage that communication. Probably they will also have to go there. Fortunately, now we have this mobile vehicle that has loudspeakers mounted. They could go there during the peak time, the peak period, and then send health messages. Hopefully, they'll listen to that. Thank you.
Member for Central Badibu.
Thank you, Honorable Minister. Since you confirmed that you got a report that it affects the traffic, particularly the ambulance coming or patient, pregnant women, is it not prudent for you to sit with the stakeholders, i.e. area council or the municipality and the market committee, to address this matter once and for all?
As I've mentioned earlier, this had been done before. They'd even been written to. And recently, in anticipation of this discussion here, we engage them again. So we'll continue. We'll do our best to ensure that it is resolved. But as I said, the vendors will also need to be assisted somewhere. So we hope, because if they don't find a place to go to, really, in fact, even if I stand there myself, they will still come and lay it in front of myself. So in front of me. So really, we hope to work together with all the partners. Thank you.
Thank you. Question number 138 of 2025 by the Honorable Member for Fonyi Jarol.
Thank you very much, Honorable Speaker. Honorable Speaker, since the withdrawal of the ambulance from the Kalagi Health Post in 2020 during the COVID-19 pandemic, the Honorable Minister of Health promised to return the ambulance to the said health post. It is 5 years now, and there is no sign of replacement after a series of follow-ups and promises. Could the Honorable Minister for Health inform the August Assembly when Kalagi Health Post will receive an ambulance?
Thank you very much. Honorable Speaker, Honorable Speaker, I wish to inform the Honorable Member for Fonyi Jarol constituency that the ambulance of Kalagi Health Post had a major breakdown, but we have put in measures to take care of the referrals of the Kalagi Health Post by using the Sinted or Campasa ambulances and sometimes the ambulance of Bondali. However, with the expectation of new ambulances, Kalagi Health Post will be given one, inshallah.
How soon is that expectation? Time frame?
We've been expecting them for quite some time now. These are ambulances that will be provided by WAHO, West African Health Organization, and they had some procurement delays, but the latest promise is October, inshallah.
Thank you. No further question.
Member for Fonyi Councillor.
Yes, Honorable Minister, thank you for that. Since COVID-19 is a while now, we were in Fonyi, we saw a lot of ambulance parading leaving our end. When I say we were in Fonyi a month ago, we have a huge ambulance, from Combos down to the provincial. What was those ambulance? Were those ambulance not catered, seeking the far need for since COVID-19? The minister didn't talk to see how they can also replace that of Kalagi. instead of moving from the Kiangs down to the URR.
Honorable, can you repeat your question?
Yes, a month ago, we've seen a huge flood of ambulance from the combos leading to the Kiangs down to the URR. Since COVID-19, an ambulance was withdrawn from Kalaji. Among those, can't you look possibly measures to see how best you can relocate one to Kalaji?
Honorable, you know that question is answered already. No, the question is fully on. Honorable members, the question, he asked questions about the ambulance at Kalaji, it was withdrawn. And since COVID-19, and the minister promised, and he asked, when will the minister provide the ambulance? And the minister responded, and he told him the reason why. And as a follow-up, he also asked how soon. And the minister told him, "You still going around the business?" No, my friend, no. The member for Fonyi Bondale, you have the floor.
Thank you, Honorable Speaker. Thank you, Honorable Minister. Honorable Minister, looking at the distance from Kalaji to Sintet, and then the neighboring district, Bondali and Wasedum, especially at night, it will be very difficult at times to get someone when an emergency arises. What short plans do you have to address this?
Address what?
The issue of the ambulance.
Address what?
The ambulance. We are talking of ambulance.
Ambulance where?
In Kalaji. Kalaji.
The minister had. It's not for the speaker. Yeah. I can go on.
You are asking when will the minister resolve the issue of Kalaji ambulance?
What I mean is the distance from Kalaji to Wasedun and Sintet.
Because that is not the discussion. The discussion here is Kalaji. Go ahead.
Okay. So what short-term plans do you have?
For?
Actually, yes.
Honorable member, order, please. Clerk, concentrate. No, you cannot be turning them instructing me. Don't do that.
So,
Honorable Minister, he said plans for the Kalaji ambulance. Huh? You've answered that several times, my friend.
So in the short term, we call for ambulances from neighboring communities. Certainly, if the distance is far, there is a tendency for delay. But those are the natural realities of a poor country. If we had all the resources, there would be ambulances every block, even in Banjul here, so that the response time is shorter, because that is the normal. So we're improving on the ambulance fleet of the country. When we started, we had about 60 ambulances throughout the country. Now we have over 170 ambulances in the Gambia. So that's a big plus. But nonetheless, it's not enough. So that's why we're talking to partners. WAHO is giving us 10 ambulances, and we're expecting more from other sources. So we keep on pushing. Inshallah, we'll be able to cover for all. And very soon, inshallah, we'll be launching the National Emergency Medical Services for this country, which certainly will require a lot of ambulances. That is also, that's for the whole country. Thank you. Yeah.
The honorable member for Central Baribu, you can take the floor now.
Thank you. Honorable Minister, can you tell us the location of the said health post? Is it that there is a dire need for ambulance, or there is no dire need for ambulance?
Honorable member, there is a need for an ambulance. Ideally, each facility that sees patients should have access to a referral system so that any patient who cannot be treated in that facility can be transported very quickly to where he or she might get assistance. So the need is there. Thank you.
Member for Kiang West, you can have the floor now.
No, I have withdrawn since Fonyi has not talked about withdrawing from Kiang to Fonyi.
Member for Nyanija, you can take the floor. Thank you. Question number 139 of 2025 by the Honorable Member for Sami.
Thank you very much, Honorable Speaker. Honorable Speaker, there is shortage of nurses in our health sectors, especially at the rural health posts in Gisadi, Nyamina Dankunku, and Madina in Same. Could the Honorable Minister for Health explain to this August Assembly what criteria does the ministry use in posting nurses to these health posts?
Honorable Speaker, I wish to inform the Honorable Member for Sami constituency that the criteria used in posting nurses to health posts is based on the availability of health workers and as per the WHO recommendation of 4.45 health workers per 1,000 population. Despite the shortfall of health workers, the Ministry of Health has recently posted more community health nurses to the provinces, and this will greatly improve the HR situation in rural Gambia. Thank you.
Thank you very much, Honorable Speaker. Honorable Minister, the reason why I brought up this question, I visited these two places. When we went there, we met only one nurse. And this trend has been continuing in those places. So, is there incentives for nurses, those go to hard-to-reach areas?
Honorable Member, no. You are talking about provide a nurse in your village and Dankunku. Now you are asking about incentive for the provision of all nurses throughout the country. No, you are extending. No, that is a new element. That is a new element. No, that's a new element. No, that's a new element.
No, that's not new.
Incentive is not there. You are not talking about salaries and allowances. It's a new element.
But shortage.
No, it's a new element.
No, don't say that.
It's new element.
In order to close that shortage, and that's what I'm
No.
It's linked to lack of nurses.
All right, let me.
Whether they are
okay, sir, take your seat. Now let me speak to members. When you were drafting your question, as you are insinuating, you knew that you said lack of this nurses shortage is because of incentive salaries and this. Why didn't you put it there? Why didn't you put it when you are drafting the question? That one is new element. Now you can ask him, you can send that question again for next session. No. Don't worry, sir. Please ask another question.
This question is in line.
I said it is not in line.
It's in line.
Okay, but not here. It can be in line in Same, but not here.
No, it's in line here.
Ah, okay.
It's in line here. Hence, the people of Same brought me here. It's in line here.
Okay,
I
please.
have that right to say.
Okay, ask another
question. You have
question.
to withdraw that. Don't say that it's not in line, sir. You have to withdraw that. You have to withdraw that.
Okay, withdrawn.
Huh?
I have withdrawn.
Thank you. Thank you. Thank you very much. Honorable Minister, Is it possible for your ministry to engage those institutions that train nurses so that the gap will be closed for the rural areas?
Thank you very much, honorable member. The ministry is aware of the situation, and it is not much different throughout the world. There are shortage of health workers throughout the world. Various countries have been putting forward various strategies. In the Gambia, one of the strategies is to train more people. So we've increased the intake at the various schools, the state enrolled nurses school, and then the community health nurses school in Mansakonko. Now, we have also worked with the state registered nurses school in Banjul to increase the enrollment, and we're getting support from various partners. In Bansang, you've seen we built a new school through the support of the MRC Holland Foundation that is geared towards enrolling more people. Now, the CHN school in Mansakonko also, we've increased the classroom sizes, the numbers of classrooms, and now we even put up dormitories so that more people will be encouraged to go to the schools in the provinces. World Bank is supporting us in training more midwives. In fact, this Saturday, a batch of those midwives is graduating. So a lot is happening with regards to increasing the HR numbers in the country. So hopefully this will help to close the gap. Thank you.
The member for Central Badibu, you can have the floor.
Thank you. Honorable Minister, are you confirming to us that the said two health posts are in shortage of nurses? And if so, what do you think is responsible for this?
Yes, we are confirming. The truth is there is inadequacy of nurses everywhere, virtually in the whole world, and Gambia is not left out. We would have wanted more health workers, even in Edward Francis Multi-Gen Hospital here. But the availability, they are not available throughout. So there are staffing norms that guide what the posting, how many nurses should be on a ward per shift. Very few countries have achieved that. So in this case, we are posting more people, and when we post, we look at where the gaps are, and we fill in those gaps. So as we are speaking, more people are awaiting recruitment, and as soon as they are recruited, they'll be distributed throughout the country.
Question number 140 of 2025 by the Honorable Member for Lower Nyomi.
Honorable Speaker, a couple of months ago, the government of the Gambia, through the Ministry of Health, distributed many ambulances to various constituencies in the country, but there was none provided for my constituency of Lower Nyomi. Could the Honorable Minister of Health inform this August Assembly when does his ministry's plan to provide Fast Njagachoy Health Center with one ambulance?
Honorable Speaker, I wish to inform the Honorable Member for Lower Nyomi constituency that Lower Nyomi was allocated previously with two new community ambulances in Tuba Angale and Makabalamane. The ministry is expecting another set of new ambulances soon, and Fast Njagachoy will be considered. However, we have engaged the Riders for Health to assess and service the two community-owned ambulances of Fast Njagachoy Health Post to maintain timely referrals. Thank you.
Thank you very much. Honorable Minister, as we speak now, that of Tuba Angale had an accident 2 years ago and is off the road. The Makabalamane one that was providing services for Fast Njagachoy also has a technical problem these days. So what is a sub-term plan to rescue Fast Njagachoy Health Center?
Honorable Member, in the short term, we will get coverage from neighboring facilities to ensure that there is full coverage of Fast Njaga Choi community. But I think we also need the support of honorable members here within the communities. Quite a number of people do not take good care of these ambulances. They think it's government-owned and they don't really care. And quite a few of these brand new community ambulances have been written off, and they cost a lot of money. And we realize that most of the time is overspeeding when there is even no patient in these vehicles. So we also appeal to you for your support in engaging the people who use the ambulances. Thank you.
Thank you very much, Honorable Minister. As I don't know whether you are aware of SL Health Center, that there is only one ambulance operating right now.
Honorable Member, you're talking about Fast Njaga Choi, and now you are jumping to SL.
Yes, in his response.
No.
Yes. In his response, he mentioned the ambulance supplied to SL Health Center. That's where I snatched the second question.
Thank you. He said that's where he snatched it. I love that.
Honorable Member, I'm not aware that there is one, but we'll find out. If the need is beyond that, they will see what is feasible. Thank you.
Thank you very much.
You can see the minister after here so that is provided. Honorable Member for Nyanija, you have the floor.
Yes, thank you very much, Honorable Speaker. Honorable Minister, we understand that all fleet from riders can be of help to some of these shortages in terms of ambulances. What happened to that old fleet? Is it reallocated to other facilities?
Thank you very much, Honorable Member. The idea is the vehicles are expected to have a lifespan. So when they have that lifespan, now that's the basis for the replacement. That's why we got the new ones to replace the old ones. We were informed that some of the old ones really can still be used. And the idea is to ensure that they cover the places that are uncovered. But what we told the Riders for Health is that they also need to look at the rate, how much we pay for the new ones, so that for the old ones, of course, they have to be roadworthy and they have to be safe. If they are, I think we should pay a lower rate for the old ambulances, because ideally they would have been replaced by now. Thank you.
Member for Fonyi Brefet, you have the floor.
Thank you, Honorable Minister. Honorable Speaker. Honorable Minister, in your response, you did mention that you have provided almost 2 ambulances, and the response of the Honorable Member, he indicated that those ambulances involved in an accident. Hence, you are aware of it now. Do you have any plan, like, to take over those ambulances and repair it, or to provide a new one for them?
Thank you very much. So some of them, they are looking at them to repair them. There are quite a number of ambulances that were involved in accidents. Some are repairable, some are irreparable. So they're assessing those. But inshallah, when we get new ambulances, we'll do the assessment, needs-based assessment, and we'll distribute accordingly. Yeah.
The Honorable Member for Kiang West, you can have the floor now.
Honorable Minister, thank you very much for the provision of the ambulances across the country. Those new ambulances that were distributed, for the fact that Karantaba is also very far inside, is it that all ambulance will be withdrawn and be given the new ambulance?
Honorable Member, you know, I told my aides, some of you were helping. You remember the other questions? because why you were supporting him so that it will open up, you have the opportunity to talk about your areas. But inshallah, the minister will provide ambulances to all the health facilities.
This is minister's constituents. Please, when the honorable speaker is taking that seat, he always back Kalinu Kunya. So please, so this is minister's constituents, please.
Okay, now, you know, minister, please, after session, see your member of parliament. You discuss the Kiang West matters. Now, the minister, yes, what do you have to say to that answer, that question?
Yeah. About the Kiang West one. Yes, thank you very much. Well, I first of all say I'm sure you are happy with the Kiang West, the Karantaba Health Center. I was there on Sunday, and it is beautifully being completed. And it looks like you are in touch with them because they mentioned the issue of the ambulance again. Actually, they currently have an ambulance that was donated by the Chinese government. So it was just awaiting being handed over to them. But why they still have not received the new one is because they had an appeal that for the treks outside the health facility, they needed the 4x4 Land Cruiser that is off-road. So that is why they have that old one. But they fortunately have a new one that is going to be given to them.
Thank you. The member for Bunuka Kunda, you have the floor.
Thank you very much, Honorable Speaker. Honorable Minister, for the sake of clarity, I just want to know, for this community ambulance, who is responsible for the maintenance of these ambulances? Thank you.
Thank you very much, Honorable Member. The government is responsible for the maintenance and the fueling and everything about these community ambulances. Thank you.
The member for Joswang, you can have the floor now.
Thank you, Honorable Speaker. Honorable Minister, you made an appeal to members to help you because of the way the ambulances are handled. Is there any more formal training to those drivers identified by the community before they are given the ambulances?
Yes, there was formal training of the drivers before they were given the ambulances. They were taught what to do and what not to do. I think it's just individual aspects, because we encourage recruitment from the community. That makes it easy for them to go to work, and then when they close, they get home. So that sometimes could be the challenge. If we get nominees that really we didn't know, whose backgrounds we didn't know, but just because communities selected them. So probably those are the learning points we are scrutinizing. So that's why we think if the communities talk to them to take care of them, because these belong to the communities really. Yeah, thank you.
Thank you. Question number 141 of 2025 by the Honorable Member for Nyamina West.
Thank you very much, Speaker. Honorable Speaker, could the Honorable Minister for Health enlighten this August Assembly on his ministry's development regarding the expansion of Nanaba Health Center, and if there are plans to build a hospital for the people of the Nyamina West? Thank you.
Thank you very much. Honorable Speaker, I wish to inform the Honorable Member for Nyamina West constituency that the Ministry of Health has plans to renovate and upgrade some health facilities in the country, especially in the rural Gambia, with the availability of funds. Considering the strategic location of Nanaba Health Post, it will be eventually upgraded to serve and meet the health needs of Nyamina West. Thank you.
Thank you. Honorable Minister, I have been hearing this for so long, but I don't know if this time I will have a time frame.
Thank you very much, Honorable Member. Actually, quite a lot of these issues are delayed because of funding shortages. Sometimes the funds are not available from the GLF, budgetary constraints, but we make sure that when we get the opportunity to engage partners, and we put it on their desk, on their tables for support. And partners, fortunately, have gotten increased levels of confidence in the government and in the ministry, and we're getting quite a lot of such support. And we hope we're going to get support to be able to carry this out. Thank you.
Thank you. Member for Nyanija, you have the floor.
Thank you very much, Honorable Speaker. Honorable Speaker, the Honorable Member is asking for a hospital in Nanaba. I don't know. Is hospital suitable for Nanaba based on the different criteria for hospital establishment?
Thank you very much. That's actually why we said we'll upgrade it when funds are available using such criteria, looking at the population and looking at the access to nearby facilities, and looking at the speed with which patients get transferred. Hopefully the road also will be done, and then good ambulances will be there, and those also all affect the position of hospitals. Thank you.
Sorry, Speaker, I want clarity, please. I did not ask a hospital for Nanaba, I asked a hospital for the people of Nyamina West.
142, question number 142 of 2025 by the Honorable Member for Nyamina West.
Thank you very much, Clark.
What are you doing, Member for Nyamina West?
Honorable Speaker, thank you very much. No, in fact, I am coming on a warning to you. This document is not very clear. It gives a very difficult.
Please go ahead. Ignore the member of Ponya Councillor. He also does the same. Whenever he's contributing, he will record.
All right. So, Honorable Speaker, could the Honorable Minister for Health inform this August Assembly on the health service delivery in Nyamina West with regards to facilities, manpower, and medication? Thank you.
Honorable Speaker, I wish to inform the Honorable Member that there are 3 health facilities in Nyamina West constituency. Nanaba Health Post with 3 trained health staff, Pinyai Health Post with 2 trained health staff, Katamina Post with 1 trained health staff. However, a new health post is being constructed at Jaren with the support from partners, and this will be completed soon. With regards to medications, most essential drugs are available in our regional stores, if not at the facilities, despite some procurement challenges. The ministry has also increased the intake of its training schools at the State Enrolled Nurses School, SEN, the Community Health Nurses, and at the State Registered Nurses Schools in collaboration with the Ministry of Higher Education, Research, Science, and Technology. This is also geared towards, or this is all geared towards meeting our human resource needs of the country. Thank you very much.
Okay, thank you very much. Honorable Minister, as you mentioned the 3, you end up with Jaring, which is not in my constituency. But I'm putting to you, if in your role you have Papa Health Post, which is in my constituency. It's a question. In your role or in the health centers that you mentioned, do you see any health center by the name Papa Health Center? Do you have any? Yes.
Honorable Member. Honorable Member, you are confusing the minister.
Okay, let me reframe my question.
Wait, you're confusing. How can you ask the minister that in his health centers he mentioned, did he see the name Papa Health Center? He talked about health facilities that will be upgraded, and he included Jaring, which is Nyamina East. And Papa Village is in your constituency. You want to know if indeed he's going to build a health post at Papa Village or what? Okay, thank you. Honorable Minister, in addition to the health facilities or health centers or posts you mentioned in Nyamina West, he said you missed out one. Papa also is in his constituency, is a health post. So he's informing the whole world.
Thank you very much. I think that would have been an omission then, but it would be known to the Regional Health Directorate that regulates health services in the regions. Yeah, thank you.
You are done. Thank you. Question number 143 of 2025 by the Honorable Member for Banjul Central.
Thank you very much. Honorable Speaker, it has been observed that in many instances, particularly cases involving injuries from crime-related incidents, victims are often denied immediate medical attention and are instead directed to first obtain police reports, a delay that can be life-threatening in emergency situations. In light of this, could the Honorable Minister for Health consider working in collaboration with the Minister of Interior to station police officers at major hospitals nationwide to facilitate prompt medical response in such cases while ensuring due legal processes are still upheld?
Thank you very much. Honorable Speaker, I wish to inform the Honorable Member for Banjul Central Constituency that the Ministry agrees that any delay in providing prompt medical care to emergencies can lead to poor health outcomes that have far-reaching consequences. In this line, a memo was written on the 23rd of November 2018, instructing health workers to accord prompt medical attention with correct documentation to all medical emergencies reporting to our health facilities, with or without police escort, and inform the police later if required. Another memo has been written as a reminder to the hospital CEOs and the regional directors for health services, and we do hope that there will be no further delay in offering emergency services. Thank you.
Thank you, Honorable Speaker. However, with regards to the collaboration stationing police officers, are you considering having small structures as a means of having police station near to ease procedural aspects that have to do with crime, the crime related to the victims? Sorry.
That is a possibility that we can explore, but previous communication did indicate that they have challenges sometimes in full coverage in many places. So that being the case, for hospitals to have 24-hour police coverage could be a challenge, but nonetheless we will engage and then hear from them. Thank you.
Member for Bundung Kakunda.
Thank you very much, Honorable Speaker. Honorable Minister, based on your response, I just want to confirm with this memo that you sent whether CEOs and hospital staff are following, because even my own hospital, I'm experiencing such, which in fact I'm planning to address. But it's good that I got this information, whether you have a mechanism to follow up to ensure that they adhere to that memo.
Thank you very much, Honorable Member. They are aware, but of course, in implementation, sometimes some people do things differently from what the rules say. So anytime we get such information, we follow it up. So we urge people to let us know anytime they face such challenges. And we'll urge the teams also to send regular reminders especially orientation of the newly employed staff, so that they get to know what the rules are. Thank you.
The member for Joshua.
Thank you, Honorable Speaker. Honorable Minister, it's good to send memos to your staffs. But my question is there any point in time where you send messages or inform the populate that there is no more need for you to go out and come with an escort with your patient? Because there can be some accident today. If you think of going to the police first before reaching the hospital. Can you please help us to sensitize the populate, please?
Thank you very much, Honorable Member. That is why when you bring this up, it's very important, because that's how we get alerted. So these questions bring these things to the fore, and with this, we remind our team, and we use our health education and promotion unit to sensitize people, so the public knows. Thank you.
Thank you, member for Fonyi Councillor. You can take the floor.
Yeah, thank you. Honorable Minister, in instance, a patient is currently in the hospital, accident. An escort was told that we would not attend to the patient unless and until the police report or escort is given. Do you have any free call line, a reporting syndrome where you may not need to go to the police within the hospital to avert this? Yeah. Do you have such in the hospital fraternity to ease some of those irregularities?
Thank you very much, Honorable Member. Typically, they are supposed to see patients with or without police escorts. What they need to do is to document what they have found. In the narrative, when they take the history, they are supposed to document what happened, the narratives from the people, the eyewitnesses, and so on. Take the history of the features that the patient presented with, because these all become evidence, and also document their findings. And while the police are being informed, the relative, if available, could be sent. But many emergency rooms, they have specific numbers of the police stations. In Banjul here, EFSTH, they have. They know the people to call in the police to report that they have received accident victims. Treatment is continuing, but they want the police to be aware for further action. But I think the important thing is the documentation of the findings, because at the end of the day, that's what becomes relevant.
Member for Fonyi Bintankranai, you may take
Thank you, Honorable Speaker. Honorable Minister, sometimes this hospital and clinic becomes a nightmare to Gambian people, to be very honest with you. And now, as you all know, the matter raised by this man is a serious concern. How ready are you for you to constantly engage your people on this matter? Because it has constantly happened, and the follow-up there is needed the most. Are you ready to make a constant follow-up on the matter?
Thank you. Certainly, these sentiments expressed here emphasize the need, and our team, they are hearing you. The director is just at the corner here, and they will take this up very seriously and engage the hospitals regularly, and also sensitize the public, so the public gets to know that really they don't need that. Thank you.
Member for Serekunda, you have the floor.
Yes, thank you very much, Honorable Speaker. That's where I wanted to drive at, as it has also.
Thank you. Then.
Yeah, for example, now the issue of public sensitization is very key, and you have said that you have all the available materials for that. So would it be wise for you people to start sensitizing people as soon as possible?
Honorable Member, that question was asked and answered by the Minister. It was asked. No. No?
Let me reframe. Maybe for the Kianka is somehow a bit. But what we are saying is like this memo you are sending, maybe that's for the authorities, but for the general public, when would you start to sensitize the people about this development?
Point of order, Honorable Speaker.
There's a point of order.
Honorable Speaker, I am rising on point of order 38J. a question fully answered shall not be asked during the same session. And the honorable member for Serekunda is asking the same question that was fully answered.
Thank you, member for Fonyi Bintang Kranai. Order sustained. Question number 144 of 2025 by the honorable member for Woolly West. Question number is out. Question number 145 of 2025 by the honorable member for Bundung Kakunda.
Thank you very much once again, Honorable Speaker. Honorable Speaker, could the Honorable Minister for Health inform this August Assembly whether his ministry has any plans in place to collaborate with NAWEC in providing a transformer for Bundung Maternal and Child Health Hospital to ensure the hospital receive required voltage and a stable electricity supply?
Thank you very much. Honorable Speaker, I wish to inform the Honorable Member for Bundung Kakunda constituency that the Ministry of Health has engaged the National Water and Electricity Company, NAWEC, to procure a new transformer to meet the electricity demand of the hospital. The Ministry made several follow-ups, and NAWEC has promised to procure a new transformer to resolve the low voltage and electricity supply at the hospital. However, the Ministry, through an EU project, is solarizing 7 hospitals, including Bundung Maternal and Child Hospital, and this will be completed soon. We have also procured a 150 kVA generator for the hospital. Once the installations are completed, the voltage problem will be resolved. Thank you. Yeah.
Thank you, Honorable. Where? Who? Thank you, Honorable Member. Member for Fonyi Bintang Karana, you may take the floor.
Thank you, Honorable Speaker. Honorable Minister, we are used to hearing soon, soon, soon. So we want to know how soon, in how many months, or how many years, or in how many weeks.
Certainly, those are subjective terms. Getting the definitive answers on the dot can be challenging. But when we say soon, we mean in some cases a few weeks, in some cases a few months. But it is dependent on a lot of factors that we do not control. That's why it's sometimes difficult to really specify exactly. Thank you.
Honorable Member for Kiang West, you may take the floor.
No, this question has been perfectly answered by the Minister.
Thank you. Honorable Minister for Health and I want to thank you for those answers provided to this August Assembly. You may leave now. Honorable members, I want to thank you and thank the Honorable Ministers and the Vice President who appeared before this August Assembly today. Honorable members, be resolved that this August Assembly do stand adjourned until Thursday, 10 July 2025 at 10 a.m. Those in favor, please say aye. Those in favor, please say aye. Those not in favor, please say no. The ayes have it. This Assembly now stand adjourned until Thursday, 10 July 2025 at 10 a.m.